Hi, we're back here at Brain Rehab channel. I'm Dr. John Hatch, and today I wanted to talk about headaches because headaches are such a vast understanding, and there is so much out there that works and so much out there that doesn't. There's apps that track migraines and headaches, and I have hundreds of patients that has seen such incredible results, and no two patient deals with the same issue with regards to headaches and migraines. So I wanted to talk about it today, and it's dear to my heart because my dear amazing spouse dealt with migraines from the time she was in second grade. She was about 8 years old, fell off of the monkey bars, and went about her day, started developing migraines, and went on this roller coaster of searching everything possible. Lifestyle changes, every medication out there, and none of it worked. Her migraines were so severe that our first year of marriage was primarily in a black room staying by herself, because when she gets a migraine, the sensitivity to light and sound is just absolutely unbearable. So many of you that are looking for a solution to your headache or migraine, I wanted to explain what might you haven't considered when it comes to headaches and migraine. So first we're going to dive into the science behind it, and then we're going to go into some possible solutions that you haven't discovered. So when we discuss migraines, we always start in the brain stem. Why? Because all headaches, regardless of their orientation, you can have a migraine, you can have a tension headache, you could have just a general headache, you could have a sinus pressure headache, you can have classical versus non-classical migraines. There's tons of different names that people assess them to, yet the research has shown that all headaches and migraines exist in the same area. All the literature that I've read on it, it's in they say the rostral mesencephalon. That's a nice way of saying the upper midbrain. And the midbrain is associated with that elevated excite, fight or flight type of section of the brain. So when we're looking at this midbrain and this upper area that's hyperactive, you're prone to headaches, you're prone to pressure, uneasiness, and as many of you know, you can gradually feel them come on, and if you do some type of intervention early, it never progresses. It's usually not just a bam, hit me. Now there's some of you that are listening to this, they're like, that's my category, and we have an answer for that. There is an answer for every illness on this planet. There's some they haven't discovered yet, but there's an answer. The question is, are we as doctors, as we as neuroscientists, are we as biologists and chemists doing what it takes to find out a solution that's different than just treading down the traditional path? And I'm going to teach you about the traditional path because with my spouse who's tried every medication on the planet, and I think medication does amazing great things for people with headaches and migraines, except if you have an imbalance between one side of the brain and the other. So we're going to take this brain stem and we're going to draw it more like straight on, because the brain's really divided in both sides, left and right. So I'm going to draw that same pink area, that's that upper midbrain, that's a headache or a migraine. Now what's important here is because there's a difference between left and right, if one side is elevated and one side is down, that will make one feel very imbalanced, and it can cause headache-like symptoms. And you take a medication that's a receptor-based, remember all medications, as we talked about in our other videos, if you haven't, watch the other video on what we talk about hubs and direct areas of learning disabilities and other things. It says in there on the last paragraph, when you talk about drugs, they work really good to specific nerves and they bind to receptors. Now that's important to know because if there's an imbalance between left and right, no medication works. Medication does not work on an imbalanced system left and right, because you either have activators or blockers, so either both will go up or both will go down, if we want to say the other way, if we increase the down, and you might feel good for a moment, but that doesn't solve anything because you still have the imbalance. So my question is, what is your imbalance? And this is where those of you that have used medication or have tried every medication and it doesn't work, it's not because the medication doesn't work. It just doesn't work with your system. So again, I'm a big advocate of everything that's out there on the planet. It's just, is it the right thing for you? That's what we're talking here. That's what we talk about at Brain Rehab. Everything works. It's just, is it working for you? And if it isn't, let's not discredit it. Let's go and find another solution that might be beneficial to you. So when we're looking at these imbalances, we really have to determine. One way that you can look at this is looking at light reflex. Some of you will have, when you have a migraine, look in your pupils. One pupil will be really big. If I was to draw the eye really quick, I know we don't have a ton of time, but if I have a pupil that's this big, and then I have my other eye, and my pupil's this big, well, there's a high probability that that midbrain isn't being regulated. We call it a midbrain escape or a mesocephalic escape. It might be elevated on the right side. Now, that's not always the case. There's actually 16 causes of, it's called an anisocoria, when one pupil's larger. Again, the 16 causes, only one of them is genetic. Only one of them is this area. Sometimes medication can do that. Sometimes a host of other things can imbalance it. So don't just use that. I'm just showing you a possibility of what you might be able to figure out. The other question is what side is the pain on? Do you have more pain and tension behind the left eye? Probably that left side is more elevated, brought to pain threshold. If the right side is more painful, maybe the right side is brought to pain. Well, I'm going to teach you a trick that you can do and find out. If you have more pain on the left side, then you might want to do some activations on the right side of your body, like a figure 8 with your right arm, or open and close your hand and see if driving that pathway decreases the tension and pressure. Well, then you know that it's very brain-based induced. When I look at the brain, I always ask the question, why is your brain doing this? Not, well, this isn't working and we need to fix this and this and this. I always want to know why. Why is your brain brought to threshold too high? And again, like we talked about with these headaches and migraines, there can be a host of different causes. I have seen a lot of people come in, yes, with emotional distress. Does emotions onset headaches and migraines? All the time. Is there problems in the environment, like pressure gradients, right? Again, a really good change and a really good help for pressure tension types of headaches and migraines. You can use a device that you might have heard, Zook, works really good on those tension pressure types of imbalances. You could have food allergies. Could be a food allergy. And a food allergy, I've seen so many of my patients come in, and people always ask, how does a food allergy create a headache or a migraine? Well, when you have a food allergy and you have different receptors going on in the gut, and you're now in this fight or flight mode because your immune system's attacking itself, then you're in that more stress. It's going to bring this midbrain, which is that fight or flight or freeze, to a higher threshold level, which then can't regulate it, and it's constantly firing into your gut. And that's why a lot of times when they first discovered like a gluten allergy, they found it gastrointestinal. But research has shown that there's a lot more effects on gluten and the brain than even on the gut. But because gastroenterologists found it first, it's discovered under that world. Emotions, pressure, food allergies. I also find that there are balance issues, which we'll get into in a whole nother video of, such as vertigo. And then last but not least, not only balance issues, but just a stable nervous system. Stable firing of your brain's circuitry. And this is what we talk about in what we call the hubs. And if we can rehab the hubs within the brain itself, you can make an outstanding change to your brain. So the question is, when you're dealing with headaches and migraines, have you exhausted every variable? And if you have, and you still can't get results, call our office and get on the schedule, because if we can find it, we can fix it. Why? Because there's always a neurological component when you're dealing with headaches and migraines, right? The biggest window into this brain is a place we call, I'm going to delete this just for a moment, okay? But a place we call the cerebellum. And the cerebellum has 3 connections within the brain. And this cerebellum is crucial for regulation. This is where GABA is regulated. And there are so many different types of cells in here, but there's only one type of cell that comes out of it, and that's called Purkinje cells. And within those Purkinje cells, most of the input into the cerebellum comes right through here, the middle cerebellum peduncle. The lower one kind of has a 1-to-1 ratio, and this one up here is mostly out. So most of the output to the midbrain comes through the cerebellum, which is why if you have a balance issue, if you have an unstable hub neurofiring problem, you're going to create a headache. It's why emotional, with the cerebellum, 20% of cerebellum is motor function. 80% is planning, emotional, and thinking. So when you're going through a planning anxiety, all of a sudden, bam, headache starts. You start getting stressed out and worried about something, you start to develop a migraine. Is that truly emotional, or is that a dysregulation in your cerebellum? This is what we see here at the clinic, and I want you to start thinking these variables. If you've taken homeopaths and you've taken supplements and they're not getting your headaches to dissipate, it's because you have an imbalance between the left and right brainstem neurointegration, not cortical, but maybe a brainstem cerebellum integration that can be lasting and changing if we go and find which areas, apply therapies and brain exercises. I'm not going to give you more brain exercises on this video. Why? Because this is so complex. And the amount of exercises that we can put towards the area that is broken down in your system can make all the difference for you. And then your loved one that has the same headache and migraine, it might cause their headache or migraine worse. When I've dealt with these wonderful people that are suffering, and my spouse that was suffering, I'm not going to give you something that's going to cause you more pain. I do no harm before harm. And I feel you should never get worse before you get better if we activate the right parts of the brain. And that's what I wanted to teach you today about headaches and migraines. So if you have a loved one, you have a friend that's suffering, send this video to them and let them understand what they might be missing. And if they have questions or concerns, comment below, call the office, and we'll get back to you as soon as we can. Thanks for tuning in.